Hello, how you doing, honey?
I'm doing great. I'm doing great. Good afternoon,
Awesome.
Dr. Montes. How are you today?
I'm doing great. I'm just here on call outside of the hospital, and I'm going to probably have two deliveries in a few hours, so ready to bring some babies into the world.
Oh my God, yay for 2021. I love it. I love it for 2021. That's really amazing. Well, listen, I'm really grateful that you're here today. Thank you so much for coming. I just want to make sure I introduce myself. My name is Ginger Birkenbeuel, and I am the CEO of Birk Creative, which is a brand strategy agency. I'm also the agency of record for CPASS Foundation. And one of the amazing things we're doing at CPASS Foundation is interviewing and championing and raising up and finding out more about all the amazing people of color that have been able to somehow, by some miracles, make their way through the medical system, the medical education system in the United States, and become amazing doctors like Dr. Erica Montes. And I'm excited to have her here today. She is a couple of hours away from delivering two babies, so we're not going to take up too much of your time today. But before I go on, I want to make sure to introduce you a little bit more with a little quick bio for you. So our STEM
Great.
story today highlights Dr. Erica Montes, a Phoenix-based OB-GYN focusing on women's empowerment and medical education. Outside the delivery room, Erica is the founder of The Modern Mujer, a bilingual Spanish-English women's blog discussing female and family health. She strives to inspire healthcare students with her expert tips and tricks and makes health jargon relatable, whether talking hormones or destigmatizing the COVID vaccine. A proud Latina, wife and mom of three boys, her knowledge gained as a mother and physician inspired her to start her own blog. Join our interview and conversation today, and we're going to learn a little bit more about how Dr. Montes is fierce as a woman in medicine. So welcome again. Thank you for joining the CPASS Foundation for this conversation to inspire young people. I want to start off right away just asking you, as a modern mujer and medical professional, you seem to be a very proud Latina female doctor. Why is it so important to be vocal about this?
Yeah, first, thank you really quickly for that amazing bio. It almost made me cry, but I think because they're only, basically 2% of the physicians in the United States are Latinas. It's very, very important, since so much of our U.S. population is made up of Latinos and Spanish speaking um, people, that patients know that there is someone who looks like them, someone who can understand them, someone that comes from a similar background. Because after all, we know that patient outcomes are better when when the physician can understand their patient, and then the patient can understand their physician. I have patients so many times tell me, "Oh my God, thank you so much. I'm so happy you speak Spanish. You really understand me. You really can relate to me." And I think that that's what it's all about.
Mm-hmm. And why do you think so? You have an amazing blog, right?
Thank you.
Why? I guess what I'm wondering is because I know that for women in general, and then Latinas in particular, being able to use your voice and having the confidence to use your voice and be strong and unapologetic. Why is it important, not only for you personally, but why do you think it's important for other Latinas, especially in the medical field, to be very, very uh, confident and bold in the message around Latinas in STEM and Latinas in medicine?
I think that when I first started my blog, I was trying to focus more on just like women's health and putting out information that's evidence-based in regards to just things that I see on a day-to-day basis in an easy to understand way. But when I kind of came out onto social media, I started getting a lot of DMs or, emails about women saying, "Oh my God, you're inspiring me to consider going into medicine. This is amazing. I've never seen anyone that looks like me." And then my focus kind of turned a little bit, where I still wanted to focus on female health and things of those topics. But then I realized, you know what, I actually can make a bigger difference, and I can use my story to help inspire other girls such as myself to go into medicine and to realize that even though there's not that many people that look like you, it's actually possible. I did feel lonely along, you know, a lot of the way through because I didn't have anyone that I could relate to or that I could ask questions to. And being the first kid in my family basically to consider to go into a higher education, that made it a little bit difficult, especially when your families don't understand that you have to work at night or you have to be on call so many hours. But you know, we got through it and everything worked out great. And so I'm just so happy that I'm able to inspire young Latinos and African American students to know that even though you know there's not too many that look like us, representation matters. And I'm so happy to be here to do that.
And when it comes to representation specifically in medicine, I know that you mentioned earlier that some of your patients have said to you, "We're so glad you understand me. You speak Spanish. I mean, I feel so relaxed." Are there any more reasons why representation in medicine is important? And I know that there's a lot around the COVID-19 vaccine and the myths and the misinformation, of course, the pandemic, but just in general, why is it particularly important in medicine?
You know, I think if a patient can see you as a human being, like I literally just had a patient today tell me when I was rounding on her, I didn't get to make her delivery yesterday because I wasn't on call then. But, you know, she told me there's certain things that I look for in a doctor. And she just told me this like a couple hours ago. But if you know, because I see you as a human being and someone that I can relate to, that's what makes a difference between me choosing one doctor versus the other. So, I mean, that's not so much, you know, in regards to my background or anything, but I think it does make a difference because I know that I was put in this place, you know, and there was so many obstacles against me. I guess I take that into consideration when I'm caring for someone because, you know, if I wouldn't have pushed myself, if I wouldn't have had those few people like push, you know, behind my back, pushing me and telling me that I could do it, I possibly wouldn't be here to be able to, you know, do what I do for these patients and be an inspiration for these students. So I think overall, it's just a matter of doctors being able to even take their background into consideration, and that knowing that you don't really come from much and you don't really have a story in terms of like so many people in your family were physicians or something along those lines, you still, you know, that makes you want to be the best physician you can be so you can prove that Latinas were meant to be here and that we have a place at the table.
I love that. That's really amazing. I know that I've read many articles that having representation in medicine when you're a patient actually brings better health outcomes. I mean, there's you know, better decisions that are being made. There's more cultural understanding. There's a oh yeah, I know exactly what you're going through because, you know, I was there. This happened to me. I get it. And I was reading a story recently about a Black woman who went into the hospital for something, and she had to have some kind of surgery on her head, and the doctor was also Black, and he actually took special care so that she didn't have to have her head shaved because, you know, the whole cultural experience around Black hair meant that he understood how important her hair was to her. So he made some changes and had some strategy differences around how he approached her because of that. And I think that when I think about representation, it's important to me. I'm also a mother of 3 children, and I was very intentional about choosing, you know, my OB-GYN for that reason because of the things you talked about. So I really appreciate that conversation. I want to ask you about high school really quickly. I know we have a few more minutes, but when you were going through high school to medical school, right? Were there any other Latinas making the journey with you? I mean, like, what? Were you the only one? Were you just like, here I am, I'm all alone here, but I'm gonna do it?
I mean, so it was funny because I actually went in to my university at UT Austin, which is the largest university in the country. I went in as pre-nursing, actually, even though I knew I wanted to be a physician. I guess I was scared. I was nervous. I didn't think I could do it. And after the first semester, I realized, you know what, this isn't for me. I know I want to be a physician. And literally all my friends who were Latinos or Latinas were switching from pre-med to something else. And I was going from pre-nursing to pre-med. and they were looking at me like I was crazy. Like, what are you thinking? Why are you doing this? And I said, you know what? I just have a calling to do this. I don't know if I'm going to make it. I don't even know if I'm going to be able to pass these classes and do everything that you have to do to get into med school. But, you know, by the grace of God, I ended up doing really well. I actually tutored organic chemistry and biology, which are, you know, biology is not super hard, but organic chemistry can be pretty tough for a lot of students.
I've
And I
heard.
just somehow, it just clicked in my head, and I said, okay, I guess I'm meant to be here. But I was really one of the only ones that looked like myself. And there were a couple guys that were Latinos that I connected with, and they helped me and I helped them. And so we kind of, and another one of my friends who is Nigerian, she's African American. Her family, she's kind of similar to me, and she actually ended up being a pharmacist. And so we connected on a lot of different levels. And so I think I found my little niche, and we were able to just push through and do it.
You know, I love that. It is important when you're in any field of education, but especially a specialized field, to
Right.
have a community when you're in college, right? Because college is hard enough, and it's very difficult socially when you're not the majority, depending on what college you go to. And so having a community of people to help you understand, you know, what are some of the paths you can take, and even some basic study tips, like how did you study for this test? You know, that's something that takes a lot of time, and it's helpful if you've got people with you. So moving forward a little bit, so do you think you're an entrepreneur because you have a blog? I have the sense that, you know, you love being a doctor, but I also have the sense that you have this like, yeah, I could kind of have my own business and do something totally different and make a lot of money. I don't have to, you know, like what is your, you know, what is your experience around that? And do tell us, what is the name of your blog? And do you have merchandise with it? Are you going to make a book? I mean, talk about your entrepreneurship space.
Yeah, thank you. I mean, I think that the options are limitless. You know, I just, my blog turned a year in October, so it's pretty brand new.
Wonderful.
But yeah, so I mean, I think I see myself, you know, speaking for students, speaking to groups that will help women, and you know, ultimately, one big thing that I really want, that I'm really passionate about, because it helped me a lot, was basically getting scholarships to kind of, you know, basically go through my whole schooling almost for free, thank God, because I was able to apply for a lot of scholarships. I want to be able to provide some scholarships for students. I think my blog has helped me gain a lot of traction with more patients being able to find me and know where I'm at. And so that really has helped. And there's also a procedure that is not here in Arizona yet, called the Assessa procedure for women who have uterine fibroids. And I'm hopefully going to be the first physician to do those procedures here in Arizona this next month coming up. So there's a lot going on. There's a lot of exciting things. And, you know, I hope as a young entrepreneur, I'm still learning a lot of things, but I think it's going to take me somewhere exciting, and I'm happy to be on this journey.
Well, I love it. We're going to have a separate conversation with you around branding and entrepreneurship, because I do think that you have that you know, vein in your body that can't resist. That's like, I have to have a business. And I would say also, I've been reading a lot about doctors that have pivoted to entrepreneurship and startup, and there's a lot of reasons for that pivot. But I do know that there's some amazing businesses that have come out from, you know, former doctors who are like,
I agree,
you know, have products they've developed, you know, and they've started entire companies, or they've gone inside to a corporation to become the principal epidemiologist, something like that. So I think that I think you should keep it going. The other thing I'll just mention briefly about brand is, you know, people, even though they're looking for a doctor, they're looking for personality and connection, as you said. And so having a space for you to communicate your own values and share your cultural experiences, that is absolutely a place for business development. I know it sounds kind of like,
no, it's true,
but it's totally true. And I think that it's becoming more important to have personalized medicine like that, right? And there's some doctors from an old school that really are hesitant about, you know, putting themselves out there. But I think it's particularly better that, I mean, women have, first of all, any woman that does this to the extent that you're doing it is actually superpowered in my opinion. So I feel like you have a superpower because you're taking it to, next level. But let me ask you one final question, because I know you got to get back and deliver those babies for 2021.
Okay.
What would you say to a middle schooler that's interested in medicine, right? But perhaps their community isn't able to support their curiosity. Now, I'm not really talking about the financial conversation, right? Because I know that there's young people that are like, there's no way, I have no money. And
Right.
I love that you're working on something, related to scholarship, things like that. But what would you say to a young person who is really probably most likely super smart, right? And they're not necessarily surrounded by other super smart people because maybe there isn't a legacy of medical
Right.
doctors in their family, right? Like, and so
Right.
what are some of the strategies you would say to this kid? Aside from don't give up, because don't give up is almost a cliche, right? Like everybody says that.
Exactly. I mean, one good strategy that I think will help is to consider, like just tangible things that they could do would be go ahead and try to start volunteering at a local hospital. I mean, right now with COVID, obviously that's going to be a little more difficult. But I mean, there's volunteer organizations at hospitals, and that's kind of how I got my foot in the door in high school. But even starting as young as middle school would be great. Going in and volunteering, seeing what life at the hospital is, seeing if you even really want to be a doctor. I mean, everyone wants to be a doctor because they want to help people and they want to it sounds like a very prestigious profession, but you have to actually make sure that this is really what you want to do. And even as young as middle school, I think you can kind of get a grasp as to, like, can I see blood, can I see myself doing surgery or whatever the case may be. So go out, put yourself out there, go volunteer, do something that will put you in that field. And then talk to your teachers and your counselors. I had two amazing elementary school teachers that I even talked to today. They follow my blog, and they even went to my wedding. But talk to your teachers, see what resources. I'm serious. Like, they were amazing, and they were pivotal people in my education and my career. So I think if you talk to your teachers, see what resources they can give you. There's so much out there. We just have to look for it. And remember, if you don't ask, you won't get what you want or what you need. So you just need to make sure that you're putting yourself out there.
Oh my gosh, that was absolutely amazing. And I love that. Thank you so much, Dr. Montes, for coming on the CPASS Foundation conversation related to STEM. Really appreciate it. I'd love to have you back sometime and maybe even have a different conversation around how you balance, branding and being a doctor.
Yes.
Because we need to talk about that some more. So thank you
I
very
know.
much.
I want to talk to you more about that. You're awesome. I appreciate it. Thank you so much.
Thank you. Well, have fun delivering the babies.
I will. Okay. Y'all have a great day. Okay. Thank you so much.
Bye. Thank you.
Bye.